Hi everyone, it's Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Today we're going to be talking about two main reasons why you have a heavy or irregular period. And honestly, I know there's fibroids, I know there's polyps, I know there's endometriosis, but these two big reasons are really the biggest reasons why women will have a manifestation of heavy or irregular periods. And I can't wait to take you through it. So let's get to it. If you found this video helpful, please go ahead and like it, please subscribe and share it with a friend. We really do need to help promote these ideas of metabolic health to other women who are experiencing heavy or irregular periods, because the solution to many of these things don't necessarily involve medication, don't necessarily involve surgery. Now, I'm an OBGYN. I think that having those pieces in my skill set are incredibly helpful. For a lot of women, they really are not in a place to do a lot of lifestyle changes or focus on their metabolic health. But it's really important to tell patients and to share with them how they got there. And so this video is going to kind of introduce two basic concepts of metabolic health that are very pertinent to women. The first is high insulin levels. Now, high insulin levels oftentimes is the big culprit behind a medical syndrome called polycystic ovary syndrome. PCOS is a big diagnosis that affects about 15% of women in North America, and it's the biggest reason why women have ovulatory infertility in their childbearing years. Now, when insulin level goes up, usually due to either chronic stress or high carbohydrate consumption, those levels elevate and they will allow your ovaries to produce more testosterone. That elevation in testosterone hits your liver and it reduces the amount of a hormone, of a protein called sex hormone binding globulin. That reduction in sex hormone binding globulin increases testosterone and estrogen concentrations in our body and allows the testosterone to cause hair where we don't want it, maybe hair loss, maybe thicker hair in our linea, our what we call the happy trail right in your abdomen. All of those signs of excess testosterone, acne, maybe at our jawline, all those excess testosterone and estrogen levels will affect our hypothalamus and change the frequency of the pulsatility index of something called GnRH. GnRH, or gonadotropin releasing hormone, will actually affect our anterior pituitary and change the LH and the FSH concentrations, the luteinizing hormone and the follicle stimulating hormone concentrations that suppress ovulation and then create those primordial follicles, those little tiny baby cysts that are around the ovaries that don't require surgical removal. Those little tiny cysts, those sub-centimeter cysts, are just ovary, or our follicles are little eggs that are just ready to ovulate, but they don't receive the proper signaling to allow them to mature into mature follicles and cause that ovulation. And it all has to do with high insulin levels. High insulin levels are the root cause of PCOS, or irregular periods, in a woman of childbearing age. And so I really think that checking an insulin level is important. Those high insulin levels can then lead to the second cause of irregular or heavy periods, which can be uterine fibroids, it can be endometrial polyps, it can be an endometritis, an endometrial inflammation at the lining of the uterus that's not infectious related. All of those things are all caused by the inflammation of high insulin levels. It actually damages the blood vessel either at the microscopic level or the larger blood vessel level at the uterus. And depending on your genetics is how you're going to manifest these problems. Some ladies manifest problems of hyperinsulinemia. They're really thin. However, their uterus starts to receive that inflammation and it develops into uterine fibroids, or what we call atherosclerosis of the uterus. And there's lots of data, lots of pathology papers that support that uterine fibroids are actually just hardening of the arteries at the level of the uterus. And atherosclerotic disease is a major manifestation of cardiovascular disease. Other women, usually women who channel and process insulin and glucose to their peripheral fatty tissue, will end up having uterine polyps and inflammation at the lining of the uterus that when ladies get their pelvic ultrasound done with their gynecologist, it's largely normal, but maybe underlying there's a polyp or there's inflammation at the lining of the uterus that doesn't allow the lining of the uterus to contract, to constrict once the lining sloughs off. Those blood vessels that are left over are so damaged from endothelial inflammation and from high insulin levels that they don't constrict, and then the period is longer and heavier because it takes a lot longer for our coagulation factors and the constriction muscles at the smooth muscle of the lining of the uterus to stop the bleeding. So if you have heavy prolonged periods, then that also might be a problem. And so it just depends on how your epigenetics, your predisposition turned on by environmental factors, and that really will depend on how your body will manifest gynecologic disease as it relates to high insulin levels or endothelial inflammation. Endothelial inflammation can come from other things too, like smoking, like from not enough sleep, snoring, diabetes, hypertension, right? Hypertension is actually hyper, and tension at the lining of the blood vessels. And so that hypertension, that high blood pressure at the blood vessels damages the intima, damages the lumen, the space at the vessel, and allows turbulence and damaging effects to the blood vessel that can lead to uterine fibroids and damage at the lining of the blood vessels and the lining of the uterus. And so there's so many things that can cause damage to the lining of the uterus and high insulin levels that are normally in our womanhood. And it is not necessarily problems with our female hormones. Actually, our female hormones are affected by normal metabolic dysfunction, normal processes of things that lead to cardiovascular disease, things that lead to high insulin levels. So really taking good care of ourselves, really getting great sleep, eating well, whole foods, lots of healthy fat, lots of protein, minimal carbohydrates really is the way to heal our body, because cholesterol, fatty foods, healthy natural fatty foods are the source of cholesterol, and cholesterol is the building block for all of our hormones. And so if we don't consume cholesterol, our liver won't be able to produce what it needs. In fact, our liver only produces 30% of our body's requirements for cholesterol, and cholesterol is the building block. And so if we don't consume cholesterol, then we are going to have some major problems, and we're going to be under crisis because we don't have the basic building blocks to produce all of our hormones that are needed for normal functioning. So I hope you found this video helpful. I really want to impress upon that heavy, painful, irregular periods, aside from problems with thyroid or prolactin or really unusual cases, are really by and large due to high insulin levels and endothelial problems. So go ahead and share this with a friend. I really do feel that these concepts are so basic, and they come over and over and over with all of our gynecologic problems. but if we just frame them and look at them from different angles, we can see how they apply and they affect our gynecologic organs. So I will see you at our next video.